Well, welcome everyone. On behalf of the Association of State and Territorial Health Officials, also known as ASTHO, we are pleased to present this webinar entitled Facilitating the National Public Health Performance Standards State Assessment Process. And this webinar is focused for both facilitators as well as the note takers. We are pleased to present Ms. Brenda Jolly as our consultant. Brenda Jolly is a member of the public health faculty at the University of Southern Maine, where she teaches both graduate and undergraduate students and leads several research and evaluation projects. Her interests include program evaluation, public health systems research, performance assessment, and quality improvement measurement. She recently facilitated Maine's statewide public health system assessment and is currently serving on the national evaluation team for the National Public Health Improvement Initiative project. Brenda earned her master's and doctorate from the University of South Florida College of Public Health. So welcome, Brenda, and I will turn it over to you.
Great. Well, thank you, Denise. It's a pleasure to be here. Let me start out by just congratulating all of you who are participating. I think it's commendable that you're taking on this assessment process, and quite honestly, I think it's an indication of your state's commitment to bringing partners together to identify your strengths, your gaps, and most importantly, opportunities for improvement. This is an important step that will lead to the development and implementation of an improvement plan for your statewide public health system, and I'm delighted to have the opportunity to provide this training to you. I hope that you find it a good use of your time. The training has been aligned with the Facilitator's Guide and the material in the toolkit, so I'll be referring to these resources throughout the presentation. I'll also draw on some of my personal experience leading these type of assessment efforts. Because this is taped, please feel free to pause the presentation if your group wants to discuss some of the issues I'm raising. This training is meant to prepare you to lead the assessment using the National Public Health Performance Standards statewide assessment tool, but there are probably some decisions and questions that you'll need to discuss as a group. So what am I hoping to cover in this training? I'd like first to spend a little bit of time making sure everyone has enough context and background information to help lead the assessment process. Now, some of this, I hope, is going to be provided during your general overview session the day of the meeting, but I thought it might not be a bad idea for everyone to get up to speed before then. Second, I wanted to spend most of our time on this training or during this training providing specific guidance for both the facilitators and the note takers, both a how-to and also a discussion on what you can expect. And again, a lot of this is based on my own experience facilitating these assessment processes at both the state and the local levels. Third, I plan to briefly discuss the meeting logistics. I think it's helpful for everybody to be on board in terms of knowing what to expect the day of the meeting. And then if there are questions or anticipated concerns, I have a few scenarios at the end, and that may be a good time for you to pause the discussion, bring in some tools from the toolkit, and engage your group in a conversation about things that you could potentially expect. So that's really what I'd like to cover over the next half hour or so. In terms of the background, I think it's really important for all of us to know the purpose and the impetus for this assessment, as well as the roles, the structure for the day, and the next steps. I suspect you already have an agenda for the assessment because you've convened all of you, all the facilitators and hopefully all the note takers for this training. So you've probably already done a fair amount of planning. In my experience, it's also helpful to have what I call an internal working agenda. And this can provide some great talking points for the facilitators. It can include background information that's useful, especially for the facilitators and note takers who haven't been part of a planning team. And I'd suggest that you spend some time as a group discussing the issues on this slide. So what is the purpose of our assessment? Is it because we did an assessment, 4 years ago and we now want to see how much progress we've made? Is it because we want to align it with some of our other assessment processes and inform our efforts with the State Health Improvement Plan or other improvement initiatives? So what's the purpose? Why are we wanting to conduct this assessment now? What's the role of the State Public Health Agency? In my experience, the State Public Health Agency is usually the organization that sort of spearheads this effort, regardless of whether they contract out for the actual assessment and facilitation process, but usually they play a key role. So what are the expectations of your state public health agency in this assessment process? How are the days going to be organized? Is it going to be a retreat-style format or a core group? And again, I imagine that you've already figured out some of the details around how this meeting is going to be conducted. And then finally, what do we plan to do with the findings? In my experience, you're bringing people together who are very busy, and they want to understand how you're going to use the results to make improvements. So I think it's important to really make sure that all facilitators are prepared to answer any or all of these questions. So if you want to take a few minutes now to discuss this as a group, you can pause the presentation. Otherwise, maybe you could make a note and add this as a future discussion item, just so that, again, you make sure that all facilitators and note takers have some of this basic background information. In terms of tips for preparing, what are some tips that I could share with you? Well, if you've conducted the National Public Health Performance Standards assessment before, I think it's important that you acknowledge this somewhere. Maybe it's in the broader group discussion earlier in the day, but participants need to have a basic understanding of the process, the participants, and the findings. If you've done it before, chances are there are going to be many people who are, again, participating, who were familiar with the process, but there will also be people who maybe didn't participate the last time around. So it's important to talk about what was done, how you conducted it, how those results were used, and how you're using those results to then inform your process. I've also learned that having confidence about this assessment process and projecting that confidence to participants really goes a long way. Let's face it, there's always going to be skeptics to this type of assessment. But I think the language that you use and any assurances you provide are really important. And given my experience, I wanted to just share with you a few things that you may want to think about as facilitators sharing with your group and even reiterating, so repeating throughout the course of the assessment. And I think you can do this either in your breakout sessions, or you could also incorporate some of this language in the general opening session with all participants. So here are a few things that I think are really important to convey. First, this is the only validated tool of its kind. It's been tested, it's used nationally, and it's been around now for 3 iterations. So that's a big deal, and I think it's really important to convey that. Second, I think it's important to acknowledge that it's challenging to do system-level assessments. No matter what process you use, they all have limitations. And this is the best one we have. It's our gold standard right now in the field, and I think it's important for you as facilitators to convey that you believe in this process. Third, I think that there are several different ways that have been tested to conduct this assessment meeting, and I think it's important that you let the stakeholders know that your approach, whatever you've chosen, whether it's a core team or a retreat-style format or maybe some other unique approach, that it makes the most sense for you, and here's why. and that you know that you've pulled together a seasoned group of professionals, and you know that they're going to be able to jump right in and get to the assessment. And then the fourth point that I think is helpful to make is in terms of the timing. I think it's important to convey that you may not have enough time to have really lengthy discussions in all of the areas during this assessment, but that the discussions are important and that you're confident that the findings, both the scores and the comments that are captured, are going to be useful for setting future direction. And I think this helps set the tone because you are trying to strike a good balance between a healthy amount of discussion, but also, as a facilitator, being mindful of getting through all of the questions you need to get through in order to have a complete set of scores at the end of this. Okay, so now let's talk about making sure you feel prepared to lead your sessions and capture the scores and capture the comments. For this part of the training, I wanted to focus on the expectations, ground rules, facilitation tips, and just some basics around facilitation, the documents you might need, ideas for getting started, and specifically how to do that in your small group, the voting process, capturing scores and comments, and then a few scenarios at the end. So in terms of the expectations, some of these are obvious, but I always think it's helpful to articulate them anyway, just so that everyone can be on the same page. So for facilitators, obviously you want to become familiar with the sections that you've been assigned to. So if you've done the assessment before, you want to take a look at the previous scores and see how, see what the results were for the essential public health services that you were assigned to, even for the model standards. You'll want to look at the specific items that you are going to be walking the group through. You'll want to take a look at identifying any potential sticky issues that come up. You guys know what's going on in your state. You know where there may be issues that are going to generate more debate and feedback. So anticipating some of those can be really helpful. Also, you'll want to know who signed up for your sessions. Some states choose to assign people to groups. So hopefully, I don't know what you're going to decide in your state, but hopefully you'll have a pretty good understanding of who's going to be participating, just given the material and the content that you're going to be covering. What else as facilitators? Well, clearly your role is to guide the discussion. You set the tone for the assessment. You have to facilitate with a firm yet a friendly hand. I mean, we've got a lot to get through, regardless of whatever approach you use. So you really are going to need to facilitate pretty actively during the process. You'll also need to develop a plan with the note takers prior to your session so that you guys can figure out how to best work together. Are you planning to use flip charts for anything? Who's going to count the votes? Is that the job of the note taker? Are you going to share that? Who wants to provide recaps? If someone says, okay, where are we? Who's going to do that? What does the note taker do if they have a question? Figuring that out ahead of time can be really helpful. And even something like, where should the note taker sit? Who's manning PowerPoint slides if you decide to project some of the questions up on PowerPoint slides. So having a conversation ahead of time to figure out some of these roles and tasks can be really helpful. From the note taker's perspective, what are the expectations? Well, obviously your role as the note taker is to record the votes. In my opinion, preferably on a paper copy. And that's just so easy to do. But you'll want to decide, again, if you want to capture all of the votes or just the final score. Sometimes the final score is sufficient. Some groups decide that they want to capture all of the votes. That's a little bit more time consuming, but if that's going to be of value to you, you need to figure that out. I know in my experience, we elected to just capture the final score, but when the voting was really close, we also indicated that as well. So this is another decision point that you as a group are going to need to decide. The note takers also are the individuals responsible for recording the comments on the laptop. or I guess you could do handwritten notes. The note takers pull out the glossary, they provide the definitions if necessary, and like the facilitators, they're neutral. They don't engage in the conversation. So the ground rules are something that you may want to mention in the general session, or if you prefer, you can have the facilitators review these in the breakout sessions. My preference, quite honestly, is to talk about them both places. In the overview session, just so everybody's on the same page, and then as the facilitator in a breakout session to remind participants, okay, here's what we've agreed to. And on the screen are some of the ground rules that I really like to go by with an assessment like this. So everyone obviously was invited because they have something to contribute. So you're looking for active engagement. They were there, they were invited, they're there because they have meaningful input and you want to hear what they have to say. It's also really helpful, again, to reiterate that there are limitations to this assessment. Yes, it's been validated and we really have confidence in it, but we recognize that it's not a perfect process, and we all just need to agree that we're going to work with this imperfect process, and that at the end, we believe we're going to really get valuable information, both the scores and the qualitative data. Another ground rule that I think is very helpful and pretty unanimous with group projects like this is the fact that people may disagree, and that's okay. And you just expect that people are going to do that in a respectful way and to tell us why they disagree. And then finally, the last ground rule that I typically talk about when I go through a process like this is the fact that we have a fairly limited amount of time with these groups and to do the assessment, and that we've got to get through this. We need their input on all of the items. So we need to agree that we're going to work through the questions without getting bogged down on the process or any one particular issue that might be heated. It's okay if some of those come up, but we may not be able to resolve those issues, nor is this the right forum to do that. And then, there are probably others that you as a group may want to add to this list. Some you may want to tweak or take off. And then finally, there may be some ground rules that your group actually comes up with that they believe are important and buy into. So let's talk a little bit about the role of a facilitator. And I know some of you probably have a fair amount of experience facilitating. Others may not be quite as comfortable in this role. What I've put on this slide is really what's appropriate and what's not appropriate in the role of a facilitator. So as I'm sure you know, your primary role is to create a safe environment. It's to figure out ways to get the group connected and working together. And quite honestly, you need to be able to do this fairly quickly given the type of assessment we're talking about. Your role is also to help guide a process that leads to a productive discussion that's going to allow you to achieve your goal. And that is basically collecting the assessment data. So you need to keep the discussion focused, you need to keep it on track, but you also need to create an environment where you're open to hearing different points of view and you welcome different points of view. Your role is to make sure that you're managing the conversation in a way that you're hearing from everybody because, again, they were all invited because they have something to contribute. And part of that is making sure that, no one person dominates the conversation. You can do this by, setting expectations, the body language that you use, and lots of facilitation tips. And then finally, I would say that it's really appropriate for you to maintain flexibility to assure that the group needs are met. I know when I've facilitated these in the past, some issues have come up, and I've really used the group to help come up with the solution. I've posed the question has come up, and people have asked me, well, what do we do about this? And then I've posed it to the group, and the group comes up with the solution. So I think maintaining flexibility so that you can get through the assessment process in a way that's meaningful to the group really makes sense. So what don't you want to do as a facilitator? Again, for many of you, this may be reminders. This may be obvious and you already know, but I thought it would just be important to mention these. So chiming in with personal opinions or experience is really not appropriate, even though you may have really great input and relevant input. Your role is not to serve as a participant. You are there solely to facilitate the conversation. And you, again, want to make sure that you're encouraging different points of view. And then you really want to make sure that you're clear with your instructions, with the scoring, with the expectations, with the ground rules, and what the process will entail, what the process entails. And again, sometimes it's finding a good balance. You have to have a structured approach. It doesn't necessarily need to be rigorous. But you want to find a good balance between having the structure you need to get through the assessment and maintaining enough flexibility so that if issues come up, you can really meet the needs of the group. Okay, so to recap, facilitators should be prepared. They need to know their audience. They need to anticipate questions, expect pauses in the conversation. Although my experience is people jump right in and have a lot of input, there are times where there are pauses and people need to think about things or haven't thought about a particular issue in a certain way. You need to understand as the facilitator the process and the scoring and be prepared to sort of lead and guide those efforts. You need to be prepared to manage the discussion, anticipating, again, sticky issues that may come up or issues that really may warrant a lot more discussion, just given what you know about what's going on in your state. You also need to make sure that you stay within the designated time frame and have a system in place for recording the information so that you have communicated with your note taker and you know how you guys are going to best work together. In the toolkit, I hope you guys have had a chance to look at this. There are actually several one-pagers that provide additional tips and strategies for facilitators. So they include the tips for enhancing your facilitation skills, active listening techniques, background information on group dynamics, and even advice for facilitating difficult situations, what you can do before a session, while that situation is going on, and even what you could do potentially after the session wraps up. In addition, there are role-play exercises in the toolkit that you may want to conduct. These group exercises provide a really good practice opportunity and can help build your confidence, particularly if you haven't done a lot of facilitation or even if you aren't as familiar with this process. A couple of more tips that I wanted to share with you are providing incentives, recognizing progress, reviewing findings, and referring to the ground rules. And these tips are really based on my own experience and things that I found to be really helpful. So I provided incentives to the groups that I worked with. I would tell them things like, we're going to get a break in 15 minutes. Let's just get through one more question. And that sometimes gave people a boost. I also realized that words of encouragement go a long way. Saying things like, we're doing great, I knew you guys would be able to jump right in and get engaged in this process. Or even something like, this is exactly the type of feedback and discussion I was hoping we would have. We are doing terrific. So I think that getting that positive feedback encourages a group and sometimes can energize them, particularly if they seem to be losing momentum. Reviewing the findings, again, that can be really helpful. Saying something like, okay, so we've done 3 of the 4 model standards for this essential public health service. We've got 1 more to go. I know we've got some improvement in this area, but there's a lot of meaningful discussion that's going on that we're capturing that I think are going to really guide our next steps. And then, in terms of the ground rules, for those that may have concerns that come up in the process, I've found that responding immediately to those concerns can be really helpful. So saying something like, well, we agree that we're going to trust in this process despite the subjective nature of this assessment. I know everybody isn't in the room who needs to be, It is one of the limitations. I think we acknowledge that, but we're capturing the comments. We've got people here that do need to be here. We've got a really good dialogue. We're capturing different perspectives. And again, I'm really confident that this information is going to be able to guide our improvement efforts, which really is the point of this. So even conveying things, again, with a level of confidence, recognizing their concerns, acknowledging them, but maintaining that level of confidence in the process, I think that can also go a long way. Okay, so let's spend a couple of minutes talking about the documents needed. From the facilitator's standpoint, I really think you need two major things. You need the facilitator's guide. This is sort of our standalone document that actually includes the entire assessment and guides you as the facilitator through the assessment process. It includes, an outline and tips and strategies. So that's really the document I think that you want to walk through the assessment process. Obviously, you also want the agenda, both the agenda that you share with the actual participants, and then hopefully your own internal working agenda that you've put together or that the planning team has put together with some talking points for you and some additional background information in case questions come up. And then I often like to have the seating plan. You may not necessarily want to put a seating plan together. You don't necessarily need to assign people seats, but I know when I facilitate sessions like this, I want to make sure that people are in a U, that people can feel like they're talking to each other. Not, classroom style is a little different. You don't want to be seen as the instructor up there. You really want the room set up in a way that the group can engage with each other. So I often ask to see what the seating plan is going to look like, not necessarily who's going to sit where, but how is the room going to be laid out. In terms of the note takers, you obviously want the instrument for recording the scores, and in my experience it's easiest to actually do this paper and pencil, as I mentioned earlier. A notes template, again, in my experience, has been really helpful. I've done it both ways, where there hasn't been a notes template and one where there has, and it's just so much easier at the end when you're trying to compile the qualitative data and synthesize it in a way that's going to be meaningful when you actually have a template. I know when we didn't do that, it was just harder to pull the information together. I wouldn't, as a note taker, I wouldn't encourage you to capture the comments verbatim unless there's, a really compelling quote or something in there that you feel strongly should be included. But I think really just summarizing the gist of the conversation and any recommendations that come up. In some of the work that I've done, we actually worked together to create a table that all note takers in all sessions could use so that we could have some standardization, and that seemed to work well. And that, again, is available on the toolkit. It could be something, and again, this is an area where you as your group, you could figure out what makes the most sense for you, but it could be something as simple as a spreadsheet with column headers that focus on, model standards, strengths, challenges or barriers, opportunities for immediate improvement, priorities, or other comments. And again, there's lots of ways to do this. I think capturing this information by the model standard, in my experience, was helpful, because if you try to capture it by item, that's just it ends up being an incredible amount of information. Whereas if you can synthesize it by model standard, again, I think when you go to put all of this together, that level of detail seems to be sufficient. Okay, so now let's just say you're in your room, you're with your small group or your core group, depending on what format you're using. So what's the best way for you as a facilitator to get started with your group? I know that you don't have a lot of time for comments, but you've got to welcome the group. It's important to welcome the group and to do introductions. And I think, again, to share your enthusiasm, to talk about what your charge is, to reiterate some of the key points from the general discussion, the fact that this focuses on the system, not the public health agency, the time frame that you have to get through this, and how the results are going to be used. I also think it's really helpful if you can talk about how what the expectations are of them as participants, and obviously spending some time on the ground rules. And then I think holding up the voting and the discussion cards and actually reviewing the process for voting is critical. People need to know, okay, what am I going to do with all of these? If you decide to put a packet together, quickly reviewing what's in everybody's packet. And then spending a little bit of time talking about some of the processes. So in terms of the voting, here's how you vote, but what are you doing? You're not probably trying to do a consensus building process. Are you doing majority vote? And if there's minority opinion, are you going to capture the comments? So just being really clear with participants how you're going to run the voting process and what's going to be captured and how you're going to be doing that and who's going to be doing that. And then this is the time to sort of at the kickoff where you'll want to make sure that you've addressed any outstanding concerns that participants may have. One thing I will say about getting started that I think you may want to consider doing, if time permits, is a quick and an easy icebreaker during the round-robin introductions. In my experience, you can do this pretty efficiently, and it's especially helpful for getting people to connect with one another in a group setting. There are 3 fun and easy ideas in the toolkit for incorporating an icebreaker in your session. So if you're interested in it, I'd encourage you to take a look at that one-pager in the toolkit, because I think, again, they'll be relatively easy for you to embed in your introductory comments and as folks go around and introduce themselves. Okay, so you've done the introductions, you've provided the background, you've answered everybody's questions. Now, what do? Well, again, the Facilitator's Guide has an outline and estimated time frames for each section that can be used as a guide to help you sort of manage your time. Again, I think it's really important for you as the facilitator and even you as note takers to review each essential public health service you're responsible for. And the outline basically walks you through the process without providing a verbatim script, which I think, having a verbatim script sometimes can appear less flexible and natural. So this gives you some structure, but still makes it seem a little bit more real, and you can, talk in the language that's most comfortable to you without, feeling like you're reading something. So you've done the introductions, you've got your facilitator guide, you've already reviewed the items. How do you actually launch in? Well, you start by reading the Essential Public Health Service and the questions that Essential Public Health Service answers. You summarize what the service includes. You highlight the major players who contribute to the delivery of that service. And then you transition to the general discussion. You encourage them to focus on what and how we're doing. You encourage them to focus, again, on the system perspective, not one agency. You summarize the key points, and then you actually move to the questions. In terms of voting, I've found that you'll get into a rhythm pretty quickly. So as long as you're clear up front what your voting process is going to entail, how you're capturing the votes, and how to vote, I think you will very quickly, as a group, get into a rhythm. And you, as the facilitator, will be able to take your cues from the group. You'll be able to tell, if there's not a lot of discussion left, that, okay, maybe it's time to vote. You can also ask, does anyone have a problem with us voting right now? If there's a lot of comments that seem to be repetitive and nobody's really adding anything new to the conversation, maybe, again, that's a cue for you that, okay, I think we've covered everything we need to cover, and maybe we can move to a vote. So sometimes you'll just get a sense and you can just launch into the voting. Other times, if it's harder to read, you can ask the group, are we ready to vote on this? And they'll be pretty honest with you. And again, just, my experience here is as long as you're pretty clear up front what the process is, participants aren't going to have a difficult time with this at all. Capturing the scores and the comments. Here, again, having the instrument to actually record the data is really, really helpful. And I've found that depending on what's in your packet, or even if you're providing packets to participants, oftentimes they like to follow along as well and see how they're making progress and record the scores, so they can be helpful. And you can talk about as a group if you want just the one final response, or again, if you want to capture all of the votes. And if you decide to capture all of the votes, maybe there's someone in the group that can help you with that as well, because that can be a little bit more time consuming to go around and count. But again, there's some flexibility here, and you'll figure out what makes the most sense for you and your state. Again, the toolkit has a template that you can use, and I identified earlier it includes things like the model standards, strengths, weaknesses, immediate improvements, priorities, other comments. And this, again, I think is one of those decision points for your group. You need to figure out how you intend to use this qualitative data, because it's a fair amount of work to collect and analyze. So what's your intent with it? At what level of detail do you want? Are you trying to capture verbatim or just general ideas and themes that come out of the discussion? And what's the best way for you to do that? And I would just encourage you to try to use a standardized approach across all sessions for your entire assessment. So in terms of the meeting logistics, I mentioned this at the beginning of the session that I wanted to spend just a little bit of time talking about this. Again, I, as a facilitator, always really want to be prepared. Where am I going to be facilitating? What's my room assignment? Are there any issues with that room I should know about? Are people going to have name tags? I've always found it easy to have the table tense, because I like to, as a facilitator, be able to call on people by name. So if that's something that's important to you, make sure you figure out some of those logistics. The seating layout I mentioned earlier, thinking about what you want the room to look like that's going to be the most conducive to a group discussion. Packets, if in fact you want to have packets for participants, and if you plan to send any material out in advance. Do you need flip charts in the room? Do you want, to capture any of that, particularly some of the early discussion just around the essential public health service overall? Do you want to capture that on flip charts? And then, just where should the facilitator stand and the note taker be? So, they're best positioned for their roles. And then any other things that may come up in terms of meeting logistics that I haven't mentioned here. So I wanted to just wrap up with a couple of scenarios. And again, I think the toolkit and some of the additional resources really spend a lot more time talking about specific techniques and strategies for all of these. And this, again, may be helpful for you to have a group discussion about. There are role-play exercises and worksheets that you as a group can complete that I think will help you, especially for those of you who may not have done as much facilitation, that may help you anticipate some situations and give you a little bit more confidence for dealing with people who come in and try to dominate the conversation, or for those people who have really valuable input but are, for whatever reason, just being very quiet. And how do you engage them in a way that's non-threatening? And what do you do with debaters who really want to just spend time debating the issues or some of the challenges versus really trying to, figure out where are we from an assessment standpoint? Or the inquisitive that just have questions about everything and aren't really contributing to the conversation in a meaningful way, but just asking a lot of questions about the process or players or who's not at the table or, who could have been here. Or the critical thinkers who really, maybe challenge challenge some of the feedback, the distractors who are, on their cell phones or having sidebar conversations. So how do you deal with all of those different types, and what can you do as a facilitator ahead of time to sort of anticipate some of these situations, and what are some specific tips that you can use in terms of your body language or even comments in terms of making sure that you maintain control of the conversation, not the conversation, but the session itself. So my last slide really just focuses on what I think in a nutshell you need to do. And I think, quite honestly, if you do your homework, you will be well prepared. If you've if you have a sense of what's taken place before and what the expectations are of you and the participants, if you've gone through some of the material that we've talked about today and really done your homework, I think you'll be in good shape to lead this assessment. I think, again, it's really important for you to be confident and also for you to be enthusiastic about this process and what this assessment will mean and the next steps with this assessment. And finally, from my standpoint, I think it's really important for you to have fun with this process. So I wish you the best of luck with your assessment. I hope that this training has been helpful, and I hope you will take a look at the Facilitator Guide and some of the additional resources in the toolkit, because I really think they could complement some of the things that we've talked about today and give you some additional tips and strategies. So again, good luck.
Great. Thank you, Brenda.